know if you can hear me. Can you hear me? Can you hear me? Hope you can hear me. All right. So we want to carry on from yesterday's class. Yesterday, we had a whole talk on body aches and pains because that's a common complaint from women all over the world. Women are complaining that their bodies are achy. They always feel sore in their muscles, sore all over their body. So we looked at that yesterday. And from yesterday's class, we had some questions. Hello, McKay. Welcome. Can you let me know if you can hear me? Can you hear me all right? Type into the chat. Let me know if you can hear me, please. Okay. Is the volume okay? Can you hear me? Right. So welcome to the class. If you were there yesterday, let me know if you were there yesterday. Type into the chat. Say, yes, I attended the class yesterday. Yes. Okay. So someone says they can hear me very well. Thank you very much. Okay. So I was reading the comments from yesterday's class, and a lady said in the class, what about pain from fibroids? What about pain from fibroids? So I'm going to address that question, okay? And some other questions that have come up. So yesterday, I talked about the body aches I was having because I've been staying active during the day, exercising and keeping active. I go for my walks. But I found out that in the mornings, I will be achy. My body will be so painful. And I couldn't understand it because I'm staying active. So why is my body still painful? So I realized that it was because I was not stretching. Stretches are so important. If you're new to exercise, you start exercising, you will notice that your body gets really painful. You get lots of aches and pains in your body. Now, if you don't stretch, you're going to get a lot of muscle soreness, and that can discourage you. That can make you feel like, oh, I'm trying to be healthy, I'm trying to exercise. Why am I in so much pain? That's because you're not stretching, okay? So I encourage you, if you're new to exercise, even those who have been exercising, always stretch. So there are two types of stretches. There's the stretches, the warm-up you do before you start the exercise, but there are stretches you have to do after the exercise, okay? Exercise without stretching is not good. It will lead you to have lots of muscle aches and pain, and that was what was happening to me then. But once I started stretching, I found out that I would wake up feeling well, no more aches and pain, just because I started stretching. And stretching is good because it increases the range of movement of a joint. Take the shoulder joint, for example. When you stretch it, you pull it and hold, you've increased the movement across that shoulder. So that next time, if you have to reach across, maybe during your normal walk to touch something, you'll find that you can do that easily. But if you haven't been stretching that area, some people, they just stretch out their hand and they feel so much pain, like a sudden pain. That's because that area has not been stretched in the past, okay? So stretching helps you to improve the movement of your joints. It makes you more flexible. It makes you less prone to injuries. You will not be easily injured if your body is used to stretches. So stretches are really important to help reduce muscle aches and pain. Right, so we're going to go to the questions now and try and answer them. A lot of questions have been sent in here. So we'll start with the first one. So the lady said, why do people with fibroids get tummy pain? Why do people with fibroids get tummy pain? Right, so the first reason is due to pressure. We all know what fibroids are. Fibroids are growths. They are not cancers, but they are like muscular growths inside your womb. Muscular growths inside the womb, and it's quite common. Lots of people have fibroids, okay? And they can get quite big. You see some people, they are not pregnant, but their tummy is big. It's full of those fibroids. Fibroids are not cancers, but they are muscular growths that can occupy your womb. Now, these can cause pressure. So those fibroids can be pressing on nerves in that area. They can be pressing on your bladder, making you want to pee all the time. They can be pressing on your rectum, your back passage, giving you constipation because things are not moving. all that can be contributing to pain in your pelvic area. So if you have fibroids, you might experience pain from pressure from the fibroid pressing on things around it. Also, the fibroid itself can grow so much that the blood supply to the fibroid is not enough for it. So the fibroid starts dying, and as it's dying, it's causing a lot of pain. So you can experience pain. So fibroids can make you experience pelvic pain, pain in your womb area, because the fibroid is too big, it has cut off its own blood supply, or is pressing on things around. So I hope that answers your question. If you're the one who asked that, I hope that answers your question. Okay, I'll be watching the chat in case people have more questions, put into the chat, okay? So we'll go to the next question. It says, why do I wake up with joint pain or stiffness? Why do I wake up with joint pain or stiffness? I don't know if you're here. That is a common complaint. You wake up in the morning, it's like your body doesn't want to function. It's so stiff, it's so painful. Right. So there are several reasons. The common one might be what you did the day before. If you were quite active, you have done some form of exercise, but you didn't stretch, you just went to bed. In the morning, you're going to wake up with what we call delayed muscle ache, delayed muscle soreness, okay? And that's because the day before you exercised so much, but you didn't stretch. So stretching after exercise is really important to avoid muscle pain. So that's one reason why you may be sore in the morning. But if you find out that you wake up in the morning and maybe your fingers, your hands are so stiff, and you're trying to get them to move, they're so stiff and tight, and it can take up to 30 minutes before you loosen your fingers to move, that's not right. That might be a sign of rheumatoid arthritis. So there's a form of arthritis called rheumatoid arthritis. That may be why you are so stiff in the morning. So that needs to be checked out. Okay, welcome, Antonio. Antonio, you're welcome. Ramat, you are welcome. Jack Salter, you are welcome. I see everybody on. Thank you so much for joining the class. Phil Oged, you're welcome. Thank you for joining the class. Thank you. Okay, let's take the other chat, the other question. It says, how can I stop persistent body aches? How can I stop persistent body aches? That's a common one. So your solution depends on what is causing the ache. And yesterday we looked at different causes of body ache, including poor nutrition. If you're not eating well and you have some nutrient deficiencies, there's some vitamins that are missing from your body, that can also result in body ache, in tiredness. You just don't feel right. Things like vitamin B12, like your folic acid, like your vitamin D, your calcium, there are certain things the body needs to function well. So you might need a blood test to try and work out why you feel tired or why you feel your body is achy all the time. Okay, so it might also be in menopause. A lot of menopausal women feel achy all the time, and we'll talk about that. Okay, so the management will depend on the cause. You might have to rest more. Maybe you're not sleeping enough. We talked about sleep at length yesterday, the role of sleep. If you don't sleep enough, you're going to be more sensitive to pain. You're going to feel pain more in an exaggerated manner simply because you're not sleeping enough, okay? So it might be that you need to get more sleep to manage your aches and pain. You might also need more gentle movements. If you're not very active, you don't do any exercise, your body is going to be stiff and hard to move. Some people feel like old people. You're just in your early 40s or early 50s and you already feel old. Your body is heavy to move. You feel so stiff. That is a sign that you need to move more. You need to find some regular activity to loosen up the stiffness in your body. That may be why you're having persistent body aches. We also mentioned that if you keep having these pains, you may need to be checked out for autoimmune disorders. So that might be a reason you might need to go to a doctor to get checked out for autoimmune disorders like rheumatoid arthritis, like lupus. There are some conditions that will need to be checked out. So someone is asking, is it normal to get muscle aches after starting a new medication? Is it normal to get muscle aches after starting a new medication? So we said yesterday that there are some tablets that can cause muscle aches. And there was a patient of ours who had lots of muscle aches. We were wondering what was going on, only to find out that 2 months earlier, she had been started on statins. She has been started on tablets called statins. Statins are used to reduce your cholesterol, so they are really good tablets, but they have that side effect of muscle pain. There are other tablets, some antibiotics cause muscle pain, some medicines used to treat cancer, breast cancer can cause muscle pain. So you might need to look at your medications to try and work out what is causing your pain. Okay, so yes, indeed, some medication can cause body pain. So someone is asking, could low estrogen in menopause be behind my aches? Could low estrogen cause my body aches? And the answer is yes. A lot of women, once they are menopausal, because when you get to menopause, your estrogen, the female hormone, the estrogen level drops. The estrogen level drops. And when that drops, you're more sensitive to pain. So a lot of menopausal women say they've experienced body ache, their body is sore, they feel achy all over. That is a common complaint in menopause. And one lady like that complained and she wanted to take HRT. HRT is hormone replacement therapy that you can take when you're in menopause to replace the estrogen you have lost. And once she started the estrogen, once she started the HRT, the hormone replacement, she said she felt like a new woman. The body aches and pains had disappeared. So yes, she had that body aches and pains due to her low estrogen level, and the estrogen we gave her as HRT helped to take away that ache and pain, and she was able to feel like a different person. So thank you, Antonio. You said I have only one ache and it's always in the same area. You have one ache and it's always in the same area. Do you mind telling us what area that is? Have you seen a doctor? Do you think it's from straining that area? Is it sort of an overused sort of ache? There are some people who experience body ache in a particular area due to the way they're using the area. Like yesterday, I told us about a lady who works in one of the big supermarkets, and because, you pick an item, you scan it and drop it that way. So she noticed that movement that way was actually causing her a lot of pain. So sometimes it's an overuse kind of pain based on what you use your body to do. Okay, she said, is there a she? Yeah, she said, I'll rather not say in public, but I could tell you later. Okay, that's fine. If it's private, that's all right. Yeah, so have a look at these different things we've mentioned, especially in yesterday's video. Go and look at that one because we talked a lot about causes of pain. So another question, it says, what about fibromyalgia? Could that explain my widespread pain? Fibromyalgia, it's a common condition. It's common in women. In fibromyalgia, you feel pain in different parts of your body. There are different areas of your body that always feels painful. But you might also find that you have trouble sleeping. You might have poor sleep. You might have fatigue. You're always tired. You might have mood problems. Or you might find that your brain is, it's like you have brain fog. So fibromyalgia is another condition that can cause widespread pain. Again, before we conclude that that's what it is, the doctor would like to do some blood tests and make sure it's nothing else. So fibromyalgia is often something we diagnose when we don't find any other thing wrong. Usually in such people, their blood test is fine, everything is fine with them, but they have this persistent body ache. They will now say it's fibromyalgia. And what's the treatment? It still comes back to movement. You have to find some form of exercise you can do and do that. You might need tablets. We talked about tablets yesterday. You might need counseling because sometimes it's your mental, if you have some emotional distress that can lead to body ache, you feel achy, but it's your body's way of complaining against the emotional distress you're having. So you might need counseling. Okay, so next question, it says, how do I know if my pain is chronic pain or just an acute issue? You're having a pain, like Antonio now, having a pain in one part of his or her body. How do I know if it's chronic or an acute issue? Normally, an acute pain you can explain. Yeah. You notice that one day you bent down suddenly to pick up something and your back went. So you know the pain came from that bending. Okay. Or you were, I don't know, someone hurt you, gave you a punch. You know that's what's caused the pain. So that's an acute pain. But then, if the pain persists beyond the time where we expect to have healed, for example, 3 months down the line, you're still thinking, you're still having that pain 3 months down the line. That's not right. It has now become a chronic pain. So the injury you had initially does not explain why the pain has carried on. So that's when you know you have a chronic pain. So chronic pain is pain that has lasted more than 3 months, pain that has persisted beyond what we would expect from the injury that caused it initially. And it can be real. Some people often feel that doctors don't believe them. You're saying you're having this pain, and the doctor is thinking you had this injury many, many months ago. Why are you still in pain? Chronic pain is not always clear. It's difficult to explain, but you're feeling what you're feeling. When you have done investigations and they can't think of anything that's causing your pain, that's where you have to practice some movement. You have to do movements. You may also have to get the help of a specialist like a physiotherapist to give you specific exercises to do. You might need counseling again to try and work out if there's an emotional aspect to the pain, because a lot of pain women have an emotional aspect to it. So that may require counseling or speaking with a physiotherapist or with a counselor, with a specialist to try and work out the pain. Okay, so Antonio says, I think a certain type of movement could definitely help with my pain. Okay, yes, there are movements that help. Things like back pain, there are specific exercises for back pain to loosen up your back. When you do them, you actually find that your back pain improves. And people can say clearly that once I started doing this exercise, my back pain improved. So please, let's not minimize the role of exercise in helping pain. I said yesterday that sometimes you're in so much pain that you don't want to move. They're telling you to do more exercise and you're like, I'm in so much pain. How can I do more exercise? So the thing to do is to take pain relief. Get some painkillers from your doctor. Take some pain relief so that you're relieved enough to start the movement. As you start doing the movement, with time, you use less and less of your painkillers, but you do have to move. Okay. Now, the next question is, could stress or lack of sleep be worsening my aches? Could stress or lack of sleep be worsening my aches? And the answer is definitely. Definitely. We talked about stress, the importance of stress yesterday. Stress is an inflammatory state. When you're stressed, your body is in inflammation. You're more prone to aches and pains. If you deprive yourself of sleep, if you're not sleeping enough, you'll be more prone to aches and pains. So I hope that answers your question. So both factors, whether it's chronic stress or poor sleep, they all worsen aches and pains. Someone says, when should I see a doctor about my body aches? When should I see a doctor about my body aches? So seek medical attention if your pain is severe, you're having unbearable pain, please seek a doctor's help. Or you're having the pain and you're having it with fever, you feel feverish, or you have a rash. If some other symptoms that is not just the pain and is persisting, then please see a doctor. Very important. If you have pain that is going to other parts of the body, maybe you're having a chest pain and it's radiating to your jaw, you can feel the chest pain in your jaw, or you can feel it in your shoulder coming from your chest, that's not right. Please see a doctor. Those watching, please, can you click the like button? Let me know if you like the show, then please click like and feel free to share the link so that other people can come and be part of the class. This is a class we're learning together. And another question, it says, could pelvic pain or issues like endometriosis be causing broader aches? Could pelvic pain or issues like endometriosis be causing broader aches? And the answer is yes. We've talked about pain from fibroids. The fibroids in your womb can actually press on other things around and cause pains that are not exactly inside your womb. The pain can be pain in your legs, or pain going to your back. Things like endometriosis, a condition, a female health problem where you have the womb tissue, not just in the womb, but in other parts of the body, other parts of the muscles of the womb, that can cause pain. Yes, so all those sort of conditions can cause pains that you're feeling in your legs, pains that you're feeling in your back, pains that are even radiating to your upper tummy, not just down where your womb is, okay? So in that sort of case, you will need a specialist to evaluate your pain. Okay, so let's have a look. Do you have any other questions before we round up? I'm going to ask you questions. So if you're in the class, I want you to give me the answer right into the chat. Okay, this is a class. So my question is, should you stretch before exercise or after exercise? If you know the answer, type into the chat. Should you stretch before exercise or after exercise? That's question number one. For those who are listening, answer the question in the chat. This is a class, so answer the question. Then my next question is, can people with fibroids have back pain? I mentioned that, so type into the chat, can people with fibroid also have back pain? So can fibroids cause back pain? Type into the chat, let me know your answer. Okay, so Antonio says for the stretches, yes, before and after. Yes, you should stretch before and after. Phil says after exercise, yes, before and after, very good. After exercise, for me, after exercise is even more important so that you avoid body ache, the delayed muscle ache the next day. Okay, so people with fibroids, can they have back pain? What's the answer? Can I have more answers? People with fibroid, can they have back pain? Yes, the answer is yes, they can have back pain because that fibroid in the womb is pressing on organs or different things around it. Okay, thank you for your answers. Very good. Now, the next question is, can someone in menopause have body aches? Can somebody who is menopausal have body aches, and why? Tell me why. Can someone who is menopausal have body aches, and why? If you say yes, why? Why do you think? We said it here. Someone with menopause, can they have body aches, and why do they have body aches? As you're thinking about that, the last question is, what type of medications commonly cause body aches? What kind of medication, what kind of tablets commonly cause body aches? If you know the answer, write into the chat. So Antonio, you said yes, those with menopause can have body aches because of hormone imbalance. You are correct. That's correct answer. Well done. You listened very well. Yes, we said in menopause, your estrogen, your female hormone level is low, and that means you're more sensitive to pains that will not even have you noticed before. Because your estrogen level is low, you're more sensitive to pain. Okay, so the next question, has someone answered? Are there any tablets you know of that can cause pain? Any medications you know that can cause pain? Who else was listening? I mentioned a type of common medication. Okay, yeah, Phil, you answered that those in menopause, yeah, their hormone is low. That's why they're also more sensitive to pain. You are correct. So the last question, can someone answer that? I gave an example of tablets that can cause body aches and pains. Even if you can't remember the name, can you remember what those sort of tablets do? Why do people take them? I gave the reason. There's a special class of tablets that commonly causes body pain. Any answers? Let's see those who are listening in the class. Any answers? Okay, so I said statins, tablets called statins, okay? And the reason I'm mentioning it is becoming quite common. Antonio said she came late to class, but you've participated really well. For someone who came late, you've participated really well. So statins are the tablets that commonly cause body aches and pain, and statins are used to reduce cholesterol levels. So a lot of people are taking them. So we must be mindful that that's a possible cause of pain. Okay, so I hope that has answered some of our questions about chronic pain. Please reach out. Don't feel you have to suffer. There's a lady I know that she had genital mutilation. You know, those female genital mutilation they do in some countries, in some places. They cut off parts of the female genitalia. So her genital area was cut out when she was young, and it healed with scars. So it healed with scarring. So she's always in a lot of pain during intercourse, and she's borne with it for years. She's endured it, not knowing that she could get some help. So if you have that sort of chronic pain, please reach out. Don't feel you have to endure this pain. We want women to have better quality of life. Okay. So thank you so much for joining the class. I don't think there's any more question. If you haven't subscribed, please subscribe so you know when I come online again, so you can join the class. And if you think of other questions, type them in the chat, and we'll have a lovely time again very soon going through all the questions. Okay, thank you. Yes, I see that. Okay, lovely. Thank you. Thank you. Bye. Have a lovely evening. Bye for now.